The CDC is receiving significant pushback from some Republican governors after its independent advisory panel voted to add COVID-19 vaccines to the list of immunizations for public school students. Almost immediately, several states announcing they won't follow the new guidelines, which are not legally binding. The CDC says it's simply following the science, while critics claim the agency is playing politics.
That will never be a pretext for there to be a mandate of COVID shots for kids. That is the parents' decision. That is not something that is appropriate to be mandated in our schools.
But most doctors and public health officials are standing behind the new guidelines. Some vaccines on the CDC schedule are already mandatory, including measles, hepatitis, and polio. Others, like the flu shot, are recommended but not mandated in most states, and it's likely the COVID shots will end up in that category.
For me, the vaccine is much better and it decreases severity. All the controversy has come from all of the people who missold this vaccine.
Health officials are also sounding the alarm about the rapid spread of RSV, a respiratory disease. It can be fatal if it's not treated. And now at least 33 states are reporting a big spike in cases just as the busy holiday travel season kicks off.
The challenge with holiday seasons every year is it's also a time where contagious respiratory viruses like influenza, RSV, spread much more quickly.
The CDC says RSV is now spreading nationwide at its highest rate in over 25 years. In Los Angeles, Jeff Paul, Fox News.
Okay, Jeff, thanks so much. Let's discuss this even further. We're going to be joined now by Dr. Lauren Block from Northwell Health to discuss this and so many facets of the COVID-19 pandemic as we approach this holiday season. Dr. Block, thanks for being with us. Okay, you saw Jeff's story there. I wanted your view. Do you agree? I know this is a recommendation. This is not mandatory, but should this be in the immunization schedule?
Yeah, so what the CDC did, what their Advisory Committee on Immunization Practices did this week was to recommend that the COVID-19 vaccine for children become part of the recommended vaccine schedule for kids. It's left up to individual states and municipalities to determine what is required for entry into school and other programs that kids attend. So I think this really still does get left up to a state by state and jurisdiction by jurisdiction basis. This just sort of puts the CDC putting their money where their mouth is in terms of making this recommendation for kids now that these vaccines have been around and available for kids for just over a year.
Dr. Block, let's talk about the case loads right now nationwide. They're very, very low, at really one of the lowest points in the pandemic. Is it your view and the view of some of your colleagues that they will spike starting into these later months when the weather gets colder, or maybe we could skip a surge? But it seems like the conventional wisdom is there's going to be some type of surge either way.
Yeah, I suspect there will be. I think, between the start of school and busy travel and holiday seasons, I suspect we will see another spike in cases. There are also new variants which are circulating, which again have more immune escape and a little bit more resistance to some of the vaccines that are out there, as well as the ability for those who have been infected before to become reinfected, all of which then plays into the reason that these new COVID bivalent boosters are available and offering some additional immunity to even those who have been vaccinated and those who may have been infected in the past.
I wanted to get your thoughts on this as well. Why aren't people getting the new COVID booster, do you think? The rates are very, very low. Are you chalking this up to maybe that people are just tired of talking about COVID, that they want to put it behind them? But, we're seeing very, very low rates so far with this booster.
Yeah, I agree. I have this conversation all day with my patients because we're recommending these new bivalent boosters for everybody, really, ages 5 or 6 and up. For the vaccines from Pfizer and from Moderna. I think there is pandemic fatigue. I think there is also vaccine fatigue. We're into flu vaccine season as well. And I think, for people that have had their second, third, or even fourth COVID vaccine, I think there is vaccine fatigue out there. And so, to that, I would say that most people have had COVID at this point in time. And I think most of my patients who have had COVID do not want to get it again. And so what I tell patients is that if there is anything you can do to prevent yourself from getting COVID or getting COVID again, then now is the time to do it while the rates are still low.
Yeah, talking about the patients you are seeing who are coming to you possibly with a COVID-19 diagnosis, is it the first time they've had it? Are they predominantly already vaccinated? And are they severe cases? What's the nature of the COVID cases you're seeing right now?
Yeah, so I am continuing. I'm a primary care doctor. And so every week I get calls from patients with COVID and see patients in the office who end up testing positive for COVID. I'd say that since January of this year, so for just about the past year, I've been seeing predominantly not very severe cases. I cannot think of a single patient that I've had that's had COVID this year who has been hospitalized due to COVID, which is great news. I'd say that the vast majority of my patients are vaccinated, have had COVID before, or both, thus ensuring some sort of immunity through vaccination or through natural infection. So I think, the prevalence of immunity within our population, as well as the changing nature of the COVID virus, for one that was predominantly associated with pneumonia to one that is more predominantly associated with an upper respiratory infection, is sort of dually responsible for the different sort of phenotype or nature of the illness that's seen now.
Yeah, and just having not seen so many COVID cases on a lot of these trackers, I kind of look at the New York Times' tracker each and every day to see what the average caseload is nationwide. It's very low, but if you go and see what the testing numbers are on average, it's almost nil, because people, I guess that is the next step. If people aren't getting COVID, then they're not going to test for COVID. Are we going to be seeing in the future basically the COVID testing regimen becoming nil?
Well, I think what's interesting is that if you do a home test, which so many of us have because the government has provided them for us, as have our insurance companies, those home tests, which may be positive or negative, may not ever reach the level of reaching the New York Times or the different news sources that report the values. And so all of the testing values and all of the case incidence values, I think, have to be taken with a grain of salt, and probably the number of positive cases can and should be multiplied. And I've heard, by our local epidemiologist, by a factor almost as high as tenfold, perhaps, from what we're hearing on the news to what's going on in reality, as so many people are testing positive at home. And if somebody has symptoms and tests positive, I think the likelihood that they do have COVID is really high. And since people thankfully are by and large not getting tremendously ill, I think a lot of these cases may not reach the level of public awareness.
Okay, Dr. Block, just last question. Let's get back to the really the headline of the week, the CDC panel recommending that the COVID-19 shot should be included in the immunization schedule. What other immunizations are in that schedule that are required? And let's go back to, vaccine rates among this specific age group. Public school children, from K through 12. Are you seeing those rates kind of remain steady? Are they lower than you would like? What's that look like?
Yeah, so most of the vaccines that are, required by the CDC and required by states and by school districts for admission to public school, things like measles, mumps, and rubella, things like the polio vaccine, which we've seen, under greater scrutiny and greater importance over the past few months. The rates of those vaccines are really high because kids tend to get it at birth. I think for all the vaccines that are required later in life, whether it be the flu shot, the human papillomavirus vaccine, Gardasil, or now the COVID vaccine, anything where vaccines are recommended by the CDC later in a child's life, the rates tend to be lower. And I think that's exactly what we're seeing with the COVID vaccine, where rates of vaccination among school-age kids are significantly lower than that amongst adults, and still the highest rates of vaccination are seen amongst the elderly, who are at the highest risk for complications from COVID-19. So I suspect that each of these, moves from the CDC recommending the vaccine, recommending it as part of the vaccine schedule, pediatricians recommending it, and the increasing amount of time that the vaccine has been out there and available to kids, and the concomitant increase in the number of kids who have gotten the vaccine and done well with it. Each of these will serve to reassure parents and healthcare providers and everyone in a child's life that these vaccines are safe and effective for kids, and will increase the rates somewhat, but I suspect that the rates will not approach that we'd like to see for kids, which would be near universal vaccination due to people's beliefs regarding these vaccines.
All right, great information there, Dr. Lauren Block with Northwell Health. We appreciate your time, and we'll definitely talk again. Have a good weekend.
Thanks so much. Same to you.